What I am about to explain may completely change the way you think about your blood pressure monitor. Because if you are over 50, the most dangerous thing happening to your cardiovascular system might not be occurring during your stressful commute, your salty dinner, or your skipped medication. It might be happening while you are lying in bed, eyes closed, completely convinced that you are resting. And when I reveal the one nighttime position that quietly helps protect your blood pressure, your brain, and your heart after 50, you are going to understand why so many people wake up exhausted, foggy, pounding with headaches, and have absolutely no idea that their body was under strain the entire night. They believe they slept, they believe they recovered, but their heart tells a completely different story by morning. And what concerns me most is this. Somewhere tonight, a man over 60 will go to bed thinking he is doing everything right. He took his medication, he watched his sodium, he walked after dinner, and then he will spend the next 6 hours snoring, oxygen levels dropping, blood pressure surging, and his cardiovascular system fighting a battle he never even knew had started. I am Dr. Emily, and I need you to stay with me because this topic is far more serious than most people realize. Here is the truth, and it is not what most people have been told. The issue is not simply about comfort. It is not just about neck pain or pillow preference, or whether you happen to favor your left side versus your right. After age 50, the way you position your body during sleep can directly influence whether your airway remains open, whether your blood pressure follows its normal healthy nighttime dip, and whether your heart genuinely gets a period of recovery while you are unconscious. And if that recovery does not happen, the damage accumulates quietly, night after night, month after month, year after year. Most people assume the dangerous part of cardiovascular disease happens during waking hours. They picture stress at work, arguments at home, heavy meals, missed pills, bad news. But some of the most consequential pressure changes occur while you are asleep and completely unaware. A healthy body is designed to lower blood pressure during sleep. Your blood vessels get a break. Your heart gets relief from the demands of the day. Your brain receives steadier, calmer circulation. But if your breathing keeps getting interrupted, if your oxygen keeps falling, if your nervous system keeps firing stress responses like an internal alarm clock every few minutes, that protective nighttime blood pressure drop can vanish entirely. Physicians refer to that as a non-dipping pattern, and it is one of the reasons poor sleep quality and obstructive sleep apnea are closely linked to resistant hypertension, elevated stroke risk, irregular heart rhythms, and progressive heart strain. So no, this conversation is not about finding a cozier pillow arrangement. It is about whether your body is genuinely recovering during sleep or silently accumulating cardiovascular damage while you believe you are resting. Let me begin with Gerald because his story reveals the mistake that gets overlooked more than almost any other. Gerald was 71 years old, retired, disciplined, the kind of man who took every medication precisely on schedule and walked after dinner every single evening without exception. His daytime blood pressure was reasonably controlled, not perfect, but managed. Yet every single morning he woke up with a dull, persistent headache settled behind his eyes. He felt groggy and slow. He needed 2 full cups of coffee before he felt remotely functional. And his wife kept telling him the same thing over and over. "You stop breathing when you sleep." Gerald dismissed it completely. He told her he was just snoring. He said everyone snores at his age. He said getting older simply meant sleeping worse and there was nothing unusual about it. But when his home blood pressure readings started creeping upward, despite no changes in diet, exercise, or medication, the truth began revealing itself. Gerald was not simply sleeping poorly, he was choking awake repeatedly throughout the night without ever consciously remembering it. His brain was pulling him toward wakefulness just enough to reopen his airway, then releasing him back into sleep, only for the cycle to repeat minutes later. That is why I need to walk you through the positions that cause problems before I reveal the one that offers the most protection. Understanding what hurts you is just as important as knowing what helps. The first problematic position is sleeping on your stomach because you believe it will eliminate snoring and solve everything. For a small number of people, stomach sleeping may reduce some degree of airway collapse. But after age 50, it frequently introduces a completely different set of problems. Your neck remains twisted to one side for hours. Your lower back compresses under the weight of your torso. Your shoulders get pulled into awkward angles that create stiffness and pain. And if you use a CPAP machine for sleep apnea, stomach sleeping can push the mask out of alignment, create air leaks, dry out your mouth, and undermine the very therapy your body depends on. People wake up assuming the position failed them, when the real issue is that they chose a position their aging spine, joints, and treatment equipment simply could not sustain through an entire night. Discomfort becomes sleep fragmentation, and fragmented sleep carries its own cardiovascular costs. I saw this pattern clearly with Lorraine. She was 67 and absolutely convinced that sleeping on her stomach was the only way she could breathe comfortably at night. She started every evening face down, one cheek pressed into the pillow, one knee pulled up, her lower back twisted. Her snoring did improve slightly, but then she began waking 3 and 4 times per night with sharp neck pain, numb hands, and a disturbing pounding sensation in her chest. She feared something was wrong with her heart rhythm. What was actually happening was that her body kept waking from positional pain and poor spinal alignment. She never achieved continuous, restorative sleep. Her blood pressure readings the following morning were consistently elevated after those disrupted nights. When we adjusted her away from stomach sleeping and supported her properly on her side instead, the nighttime awakenings decreased, her CPAP mask fit improved, and the morning pounding sensation gradually resolved. Stomach sleeping is not the heroic solution many people imagine it to be. For a significant number of older adults, it simply replaces one source of nighttime stress with another. The next problematic position is one that fools people into believing they have discovered a clever cardiovascular hack when they may actually be masking a warning sign. This is the habit of sleeping propped up on a mountain of pillows with the chin folded downward toward the chest. People adopt this position because they feel they breathe better sitting partially upright, and temporarily, some do. But there are 2 important concerns. First, when the head bends too far forward, the airway can actually narrow rather than open. Second, and this is critical, the need to sleep sharply upright can itself be a clue that something deeper is wrong. Needing to elevate significantly to breathe comfortably can occur with severe acid reflux, nasal congestion, obesity, or obstructive sleep apnea. But it can also be an early sign of fluid retention or heart failure. When the heart struggles to pump efficiently, fluid can accumulate in the lungs when lying flat, creating a sensation of breathlessness that improves when you sit up. Victor was 74, and for months he proudly told everyone he had conquered his nighttime breathing difficulty. He constructed an elaborate arrangement of 4 pillows and slept nearly sitting up every night. His wife thought it was resourceful. He considered it harmless ingenuity. But then his ankles began swelling. He became winded walking to the mailbox, and one night he woke gasping so severely that he abandoned the bed entirely and spent the rest of the night in a recliner. That was not a sleeping preference, that was a symptom. When he was properly evaluated, it became clear that fluid was backing up because his heart was not pumping as efficiently as it needed to. The pillow arrangement had been hiding a condition that should have been investigated weeks earlier. If you suddenly find that you cannot lie flat without feeling short of breath, do not simply solve the problem with additional pillows and consider the matter closed. You need medical evaluation. Sometimes the most dangerous sleep position is the one that conceals a condition instead of revealing it. The next position that deserves serious attention involves sleeping flat on your back after consuming alcohol, taking sleeping medication, or anything else that excessively relaxes the muscles of the throat. This is where ordinary snoring crosses into potentially dangerous territory. When you lie flat on your back, gravity naturally pulls the tongue and the soft tissues at the back of the throat downward and backward. Now add alcohol, a sedative medication, or profound physical exhaustion, and the airway becomes substantially more likely to collapse partially or completely. That means more pauses in breathing, more drops in blood oxygen, more surges of stress hormones, more spikes in heart rate and blood pressure during hours when your cardiovascular system is supposed to be in its calmest, most restorative state. Many people over 50 do not appreciate how much more vulnerable they have become to this particular combination. They rationalize it. They say they only had 2 glasses of wine. They say they only took 1 sleeping pill. They say it only happens on weekends. But the cardiovascular system does not operate on a weekend schedule. Interrupted breathing produces the same physiological consequences, whether it occurs every night or just frequently enough to accumulate damage over time. I remember Helen clearly because her mornings revealed the pattern before any formal test confirmed it. She was 69. On evenings when she had herbal tea and watched television before bed, she woke feeling reasonably rested. On evenings when she had wine and fell asleep flat on her back, she woke with a parched mouth, a racing pulse, and a blood pressure reading consistently 15 points higher than her baseline. She believed the wine was helping her relax into sleep. In reality, it was relaxing her throat muscles just enough to worsen her breathing throughout the night. Her husband noticed the correlation before she did. More snoring, longer pauses between breaths, startling gasps that shook the bed. It was positional and chemical at the same time. When she transitioned to side sleeping, reduced alcohol consumption near bedtime, and pursued evaluation for possible sleep apnea, the morning blood pressure surges improved meaningfully. That is the kind of practical connection I want you to remember tonight. Back sleeping combined with anything that further relaxes the airway can quietly transform sleep from recovery time into repeated cardiovascular stress. Now we need to address something that generates enormous confusion online. There is a widespread belief that sleeping on the left side is automatically superior for every single person in every situation. That is an oversimplification, and if you follow it blindly, you may either scare yourself unnecessarily or ignore a genuine warning your body is trying to deliver. Left side sleeping can be genuinely helpful for people who struggle with nighttime acid reflux. The anatomy of the stomach and esophagus means that lying on the left side tends to keep gastric contents positioned where they belong, reducing the likelihood of acid rising into the throat. For some individuals, that translates into fewer nighttime awakenings from coughing, choking, or burning sensations that can easily be mistaken for cardiac symptoms. But left-side sleeping is not a universal protective shield against stroke or heart attack. The real benefit lies in its ability to improve breathing quality, reduce reflux-related disruptions, and preserve continuous, uninterrupted sleep. That is a meaningful advantage, but it is a very different claim than suggesting one side of the body possesses magical cardiovascular properties. There is another important consideration. Some individuals, particularly those with existing heart failure, report feeling distinctly more breathless or uncomfortable when lying on their left side. They naturally gravitate toward the right side and sleep better there. Researchers and sleep specialists have observed this pattern and discuss it with appropriate nuance, because the evidence base is not identical to what we know about positional therapy for obstructive sleep apnea. The message here is critically important. If you experience chest pressure, a sensation of air hunger, or unusual discomfort specifically when lying on one side, do not ignore that signal. And do not force yourself into that position simply because an internet video told you it was universally best. Your body may be communicating something meaningful about reflux, lung function, or cardiac strain. After age 50, dismissing that kind of positional clue can be genuinely dangerous. Comfort sometimes carries diagnostic information. I think about Leonard often because he described this phenomenon with remarkable precision. He was 78 and he told me plainly, "The moment I roll onto my left side, my chest knows." He was not panicked. He was not being dramatic. He was simply observant. He consistently slept better on his right side and worse on his left, particularly on nights when his legs were slightly swollen and he felt a fullness in his chest. That did not mean right-side sleeping was curing anything. It meant the discomfort was a clue. And when he was properly evaluated, his heart failure management needed adjustment. If he had listened to internet slogans instead of his own symptoms, he would have kept forcing himself into a position that made him miserable without ever addressing the underlying problem. This is not about superstition or folklore. It is about physiology. And physiology is deeply personal. The safest general advice is only truly useful if it still leaves room for your body's individual warning signals to be heard and respected. So, if stomach sleeping creates more problems than it solves, if pillow towers can mask serious conditions, if alcohol worsens back sleeping, and if the left versus right debate is more nuanced than most people realize, then what is the one position I most want adults over 50 to understand and implement? The most protective sleeping position for many people after 50, especially those who snore, gasp, wake with headaches, or have obstructive sleep apnea, is side sleeping. Not partially on your side while gradually rolling onto your back. Not twisted awkwardly with limbs at odd angles. True, supported, sustained side sleeping with enough structural support to keep you in that position throughout the bulk of the night. This is the position that for a significant number of people keeps the airway substantially more open. reduces the frequency and severity of breathing interruptions, decreases snoring intensity, and gives blood pressure a meaningfully better chance of following its normal, healthy nighttime dip. This is the position that often transforms the entire night from a physiological struggle into genuine cardiovascular recovery. And most people never appreciate how profound the difference can be until they try it correctly with proper support. Let me bring Gerald back because his experience is truly the heart of this entire conversation. Gerald eventually completed a sleep study. The results were unambiguous. His breathing disruptions were dramatically worse when he was positioned on his back. When he was on his side, the events decreased significantly. Not eliminated entirely because some individuals still require CPAP or other interventions, but reduced enough to clearly demonstrate the mechanism at work. Gravity was a central part of the problem. When Gerald slept flat on his back, the soft tissues of his throat collapsed inward repeatedly throughout the night. His blood oxygen dropped. His brain kept yanking him toward partial wakefulness to reopen the airway. His pulse surged. His blood pressure never achieved the calm, restorative nighttime decline it was physiologically designed to experience. But when he maintained a side-sleeping position, his airway remained more stable. The snoring softened considerably. The choking episodes decreased, and within weeks, his morning headaches became less frequent. His wife was finally sleeping through the night beside him, and his home blood pressure readings began making far more clinical sense. The night stopped functioning like an assault on his cardiovascular system. But I need you to hear something very clearly at this point. Side sleeping is not magic. It is not a guaranteed shield against any disease. It does not replace blood pressure medication. It does not substitute for stroke prevention strategies, cholesterol management, diabetes control, or proper treatment for diagnosed sleep apnea. What it does is remove one of the most common positional triggers that worsens breathing during sleep. And that matters enormously, because the chain reaction that follows is remarkably powerful. Airway collapse leads to drops in blood oxygen. Oxygen drops trigger a sympathetic nervous system stress response. That stress response elevates heart rate and blood pressure, and that sequence repeats itself over and over for hours throughout the night. That is how something as seemingly simple as a sleeping position becomes directly relevant to hypertension, cardiac arrhythmias, stroke risk, and progressive heart strain. Not because the mattress possesses mystical properties, but because breathing and circulation are inseparable physiological systems. Once you grasp that connection, the entire subject stops sounding like wellness advice and starts sounding like clinical science, because that is exactly what it is. Now let me share the experience of Denise because she represents the kind of patient many people watching will recognize in themselves. Denise was 63 years old. She was not overweight. She did not consider herself a heavy snorer, and she was absolutely certain that sleep apnea was a condition that only affected large men who fell asleep in recliners watching television. But she woke up feeling unrefreshed every single day. She had persistent difficulty concentrating at work. Her blood pressure had gradually migrated from borderline readings to stubbornly elevated numbers that were becoming harder to control. And occasionally, she would wake in the middle of the night with her heart pounding and an unsettling sense that something was wrong. There was strain on her cardiovascular system, but the source was nighttime breathing disruption. Her symptoms were consistently worse when she ended up on her back during sleep. She did not even realize she was rolling into that position after midnight. When she began side-sleeping with a support pillow behind her back and another between her knees, the difference became noticeable within days. Less dry mouth upon waking, fewer jolting awakenings, quieter nights, and eventually, a formal diagnosis that explained the rest of the picture. That brings us to a crucial warning, because this is where well-intentioned people make a potentially dangerous mistake. They hear the advice to sleep on their side, and they stop thinking any further. But if you snore loudly, if someone has witnessed you stop breathing during sleep, if you wake choking or gasping, if you need to urinate multiple times per night, if you consistently wake with morning headaches, if you feel profoundly exhausted despite spending adequate time in bed, if your blood pressure remains difficult to control despite medication, or if you find yourself falling asleep involuntarily during meetings, movies, or while driving, please do not tell yourself that a simple pillow arrangement has resolved everything. Those are classic indicators that you may need formal evaluation for obstructive sleep apnea. And untreated sleep apnea does not merely steal your energy. It is independently associated with resistant hypertension, atrial fibrillation, recurrent heart attack risk, elevated stroke risk, and other serious cardiovascular consequences. Side sleeping can help many people meaningfully, but some individuals require formal treatment beyond positional changes. The sleeping position is a powerful tool, not a justification for avoiding proper diagnosis. So how do you actually implement side sleeping effectively for a body over 50? This matters because many people who consider themselves side sleepers are actually back sleepers in disguise. They start on their side, but roll onto their back within minutes of falling asleep. First, support your head so that your neck stays in a neutral position, not tilted sharply upward and not collapsing downward toward the mattress. Second, place a pillow between your knees. This prevents your hips from rotating and your lower back from twisting during the night. Third, if you consistently roll backward onto your back, place a firm pillow or rolled blanket behind you to make the back position less comfortable and less accessible. Some people use simple devices designed specifically for positional therapy. Others use the classic approach of securing a tennis ball to the back of their sleep shirt to discourage rolling flat. Fourth, if acid reflux wakes you during the night, favoring the left side may help reduce symptoms. But if one particular side consistently makes you feel short of breath or produces unusual chest discomfort, pay close attention to that signal. Comfort is not everything, but it is information. Fifth, if you use a CPAP machine, build your side sleeping setup around the mask, rather than abandoning the treatment because of positional difficulties. Many modern masks are designed to accommodate side sleeping. Work with your equipment rather than against it. I had a patient named Warren who told me flatly that he had tried side sleeping and it did not work. When I asked him to demonstrate what he meant, he lay down half-twisted, his top shoulder rolled forward, his chin tucked uncomfortably, one flat pillow barely supporting his head, and within seconds his body began drifting backward toward a supine position. That was not side sleeping. That was a slow-motion collapse into the exact position we were trying to avoid. Once we adjusted his pillow height, added back support, and gave his knees a comfortable resting place, his body finally stopped fighting the position. The following week, he returned looking almost offended by how straightforward the solution had been. He said, "You are telling me that all this time it was just the setup?" Yes, often it is, because the goal is not to begin on your side for 5 minutes before unconsciously rolling flat. The goal is to protect your breathing for the majority of the night. That requires structure, not wishful thinking. There is another dimension that people frequently overlook. Sometimes the first indication that your nighttime position is harming you is not obvious snoring. Sometimes it is subtle. It is blood pressure that reads highest first thing in the morning. It is a partner who mentions you seemed unusually restless. It is brain fog that settles in by mid-morning. It is irritability you attribute to aging. It is the need for 3 cups of coffee before you feel alert. It is the dry mouth upon waking. It is the repeated trips to the bathroom during the night because sleep disruption alters the hormonal rhythms that regulate fluid balance. Your body may be leaving a trail of clues that your sleep is fragmented long before anyone uses the clinical term sleep apnea. And once you connect those clues to your sleeping position, you can begin asking the right questions and pursuing the right evaluations. That matters because people too often wait until a frightening event forces the conversation. I would far rather you discover the pattern through a pillow adjustment than through an ambulance ride. Now let me tell you about Irene, because her experience may protect someone reading this today. The goal is never to blindly obey an internet instruction. The goal is to protect your breathing and preserve continuous, uninterrupted, restorative sleep. For many people, that means side sleeping. For some, it means side sleeping combined with formal treatment such as CPAP therapy. For others, it means recognizing that unusual positional discomfort is itself a signal worth discussing with a healthcare provider. Medicine is rarely one size fits all. But when it comes to snoring and obstructive sleep apnea, staying off your back is one of the most consistently useful general principles available. That is the anchor I want you to carry with you. So tonight, before you get into bed, I want you to ask yourself a few straightforward questions. Do I snore? Has anyone observed me stop breathing during sleep? Do I wake with headaches? Do I wake with a dry mouth? Is my blood pressure most difficult to control in the morning? Do I wake feeling tired despite spending sufficient time in bed? Do I become drowsy during the day at inappropriate times? Once you begin viewing sleep as cardiovascular recovery time rather than simply unconscious downtime, your priorities shift very quickly. I am Dr. Emily, and here is the practical protocol I wish more people over 50 would follow. Choose side sleeping as your default position, not as an occasional experiment. Build proper structural support with appropriate pillow height, knee separation, and back support. Avoid heavy alcohol consumption close to bedtime if snoring or gasping is part of your history. If reflux disrupts your sleep, favor the left side. If one particular side consistently makes you feel breathless or uncomfortable in a way that seems abnormal, do not dismiss that signal. If you or your sleeping partner notice choking, prolonged breathing pauses, or severe snoring, pursue formal evaluation for sleep apnea. If you already use CPAP therapy, optimize your mask setup for side sleeping rather than abandoning the treatment. And pay careful attention to your mornings. They often reveal whether the preceding night protected you or punished you.